Body parts wear out, cartilage breaks down, and due to overuse, wear and tear, car accidents, sports injuries, and trauma, areas of injuries develop. The two types of cells that we're going to focus on today are platelets, which are gotten from a simple blood draw in your arm. Those cells, which are normally used to clot blood, are then spun in a spinning device called a centrifuge. That allows us to concentrate them into what's called a platelet-rich plasma, or PRP. We then take those cells, which are your own body's natural cells, that contain proteins called growth factors and anti-inflammatory factors. In fact, a few years ago, Steph Curry, one of the guards for Golden State Warriors, tore a knee ligament. In 2 days after the injury, he was given a platelet injection with ultrasound guidance. He was back playing in 9 days and scored 41 points against Portland. The second type of cells are more powerful cells called stem cells. These have 15 to 20 times the growth factors, anti-inflammatory factors, but more importantly, regrowth and cartilage regeneration factors that platelets have. Stem cells come from either fat or bone marrow. For our purposes in orthopedics and muscles, bones, and joints, today's talk will focus on those stem cells taken from bone marrow. A simple procedure in the office using local anesthesia can draw stem cells from the back of the pelvis. Again, the cells are placed into a spinning device called a centrifuge and concentrated. We then use an ultrasound device to precisely place the stem cells into the area of injury, arthritis, or pain in order to get a beneficial effect. That procedure can also be done in a hospital setting with an IV sedative in some cases. Everybody will react differently to these treatments, but the FDA has shown that these are safe for use as long as it uses the person's own blood. The other options we have are to actually take the stem cells and use them for regrowth of cartilage or avoiding a surgical procedure which may be more invasive, such as a joint replacement or a more extensive procedure for a problem. Many people are poor surgical candidates due to medical conditions. Some people are too young for joint replacement surgery, and others just don't want to have surgery. You don't have to be a professional athlete to benefit from these emerging biologic tissues. They have the ability to help heal, help control pain, and give safe alternatives for chronic problems or acute injuries that people want to recover more quickly from. Finally, they've been a useful adjunct to some arthroscopy procedures that are performed in the shoulder, hip, knee, and ankle, and they can help speed healing or prevent scar tissue after procedures to hasten recovery and return to activities.